This is a video, I'm not really sure what it's about, but I just wanted to make a video about having started on Ovestin, which is it's a form of HRT. I had a hysterectomy 2019, around about the middle of 2019, or it might have been September or something. I don't know, about 18 months ago, a while ago. And they took my uterus, my cervix and my fallopian tubes, but they left my ovaries. So I didn't go into that automatic menopause, thank goodness. I have made other videos about my hysterectomy, like leading up to it and post-op and everything. So if you want to know more about that actual process, you can go and have a look at those videos. This is just about where I'm at the moment. So, yeah, I had the hysterectomy and everything was great. You know, I obviously no more bleeding, nothing like that. I have noticed a few things have changed since then, as you would expect. Because I don't have a cervix anymore, there's no absolutely no more cervical mucus that that comes out of my vagina anymore. And I will say, if this is my first video that you're watching, a warning, I don't hold back. So if you're a little bit of a sensitive soul, just don't watch this video, because this is basically all about my vagina. So yeah, I don't have cervical mucus anymore, which means I never need to wear panty liners anymore. There's just no more discharge at all. And oh God, I hate that word. I would rather say moist. There's no more moistness. And I was on the phone to my GP the other day and I had to say discharge about 14 times. It was just, every single time I've got to say, it's just one of those words, as TMI as I am. So there's no more discharge. So things, everyday things are a lot drier than what they used to be, but not like a desert dry. It's not that sort of dryness. But obviously it has been causing me a few problems. When I have sex, no problems at all there. Nothing there has changed. I'm a person who has more than enough when I have sex. Never ever been an issue. That's not changed. My GP keeps saying to me, oh, you'll need to use lube now when you have sex. And I'm like, no, I don't need to. I'm never going to need to. That's not an issue. That is absolutely not an issue. Except for one guy that I slept with a couple of months ago who complained that it was too wet. What is too wet for sex? Coming from a man who gave really sloppy wet kisses, that was a little bit rich, I thought. Didn't sleep with him again. What else has happened? So yeah, so that side of it is fine. But I have also noticed, like with regard to sex, I have been getting UTIs pretty much every single time I have sex. And I've had, just since I had bacterial vaginosis before I had the hysterectomy, but there was one guy I was seeing many years ago, and every single time I slept with him I got bacterial vaginosis. It was awful. And for those who don't know, bacterial vaginosis, it's not an STI, but you can get it from having sex, but it's not an STI. It's just it's a bacterial infection, and it's really revolting. But since I've had the hysterectomy, and it was only about 18 months ago, and I haven't had that much sex, I've had it, I think 2 or 3 times, and every time I get it, I have to have antibiotics, and the antibiotics are really, really strong. So the constant UTIs every time I had sex, and when you have sex, you're supposed to, you wee before you have sex and you wee after you have sex. I do that, and that's supposed to prevent the UTIs from happening. I'm really hot. I've been doing that, and I've still been getting the UTIs. I haven't had antibiotics for them because I just, I keep Ural sachets here, so as soon as I feel, you get that, you wee, and then you get that pain just as soon as you finish weeing. So as soon as I get that, I had the Ural sachets a couple of times, and it seems to nip it in the bud. But I haven't had sex now for, I don't know, like about a month or something, and it still keeps coming back. Like I'll have the Ural sachets and I'll be all right for a while, and then it comes back, and like you need to wee every 10 minutes, and it's giving me the shits. So I'm going to have to go and see my GP and actually do like a urine test to test for UTIs in case I've just got something just rumbling there that's not, taken off really badly, but that does need a little bit of antibiotics to nip it in the bud. So, I spoke to her about that a few weeks ago, and I spoke to her about the recurrent bacterial vaginosis, and she, because of that, and because I have had the hysterectomy and I'm 53, if I would at least be in perimenopause, but I may also be in menopause, I am allowed to have HRT now. So I don't want to take like actual HRT tablets, because that puts me at a higher risk for breast cancer and I think heart disease and all this sort of shit. So she gave me Ovestin, which is a vaginal cream. It's estriol, which is a form of synthetic estrogen. And for the first 3 weeks, I used it every day. And now I just use it twice a week. It's really easy. It comes with an applicator, but she said to not use the applicator and to not use as much as it said. So, because it has to be used internally. So I just put a little bit on my finger, like, a little squirt, about that much. Little squirt, twice a week, and I just put it inside and then just like rub it around outside a little bit. And that's it. It's done. And so that... obviously hasn't helped with the UTIs because I'm still getting the symptoms, but I may have had an underlying UTI that actually needs to be treated with antibiotics. And I think I have had bacterial... Oh, yes, I have had bacterial vaginosis since then because I've had sex since I started using the cream. But I've got a really, really sensitive vagina. Now, when you have sex, if the guy goes anywhere near your actual, like your bum hole, like with anal or fingers or, whatever other things people like to do that I really don't like to do. But sometimes even with, normal regular sex that doesn't involve anything going in your bum, sometimes, they slip or they get a bit excited or whatever, and they double dip, right? And when you're in the moment, you're not sort of thinking to say to them, you can't do that. So this guy did a little swipe down with his fingers and then came back up, and I thought, I'm going to get bacterial vaginosis from this, for sure. Most normal people, I've spoken to my friends, it doesn't happen to them, but I'm very, very sensitive. So I got bacterial vaginosis. I'm pretty sure it was from that. So I have had a course of antibiotics since then. So I don't know if that's going to keep happening or not. I don't know if the Avestin will be enough to prevent that from happening. I don't know. Because your cervix, with all that mucus, its job is it's the cleaning unit. So without that extra help with that little cleaning unit, you are more prone to UTIs and bacterial vaginosis and all that sort of thing. You don't need to go berserk with cleaning it. I certainly don't recommend douching or even using soap or anything. I just use water. That's all I've done for many, many, many years now. I just give everything a good rinse out with water when I have a shower. So I think once I go and get this recurrent UTI sorted out, it'll be a lot better. I thought with using the Avestin cream that I would have problems with, well, not problems, but I thought I would have to use a panty liner the next day because, like when you put the cream like up inside your vagina, like when you've got thrush and you use the cream inside and then, the next day it's still coming out because it doesn't all fall out at once. It's not like that. There's nothing there. I don't even need to use a panty liner the next day. Now, as far as menopause goes, or perimenopause, I'm pretty sure, given my age and given that my mum had completely, utterly finished menopause by the age of 42, and I'm 53 now, I'd be very, very surprised if I'm not in perimenopause. And I even have a feeling that I have been in perimenopause for many years, and the bleeding that I was having prior to having the hysterectomy wasn't so much periods and more just hemorrhaging from a uterus that was just all sorts of fucked up. So because I don't get periods anymore, and that's how you notice if you've gone through menopause or not, because your periods stop, I don't know where I am, and I mean, I could probably qualify for a blood test now because it's been so long since I had a, period. Um, I think that I do still ovulate sometimes. Pretty sure I ovulated today, because I get the ovulation pains, and I'm pretty sure I have what I call a period, because I get and this isn't regularly. This is like all over the place. I get period pains, which I had previously always thought were coming from my uterus. Now I don't have a uterus anymore, so those pains that I used to get with my period they're coming from somewhere else in my pelvis. I do still get that, that heaviness and that ache that feels like I have a period, but I obviously don't. I get the sharp ovulation pains every now and then. Um, and I'm not really paying attention to if it's regular, because I don't need to. I used to pay attention to when I ovulated, so that I'd know that, roughly 2 weeks from now I'm going to get a period, or, like when I've been like having sex, so that I'd know, or, definitely don't have unprotected sex right now because you could get pregnant. By the way, that Billings method, if you don't use it, doesn't work properly. I've got a 25-year-old daughter to prove that. I didn't do enough research into it, but I don't mind it because I got my daughter out of it. Yeah, so I don't know. Maybe my ovulation and my period pains are regular, but because I'm not paying attention to, exactly when they're happening, I don't know. And it doesn't really matter to me anymore because, I'm not going to get any surprise bleeding or anything. Actually, I wrote notes so that I wouldn't forget anything. I'll finish talking about the sex bit and then I'll go on to the other stuff. With using the Avestin cream, because it is a hormone cream, it's like a synthetic estrogen. I know that if men need testosterone therapy and they're using a testosterone gel, they have to be very, very careful with where they use that gel on their body if they have a partner, because like if they rub it on their neck or something and then their partner kisses their neck or, like licks their neck or whatever, they can ingest some of that testosterone, and it's a very bad idea. So I did actually have to have the conversation with my very, very nice, sweet GP. What happens when I'm using this cream if I'm having sex and the guy wants to give me oral sex? Is it going to be bad for him if he like ingests some of it? If it's like, like even if I've used it the night before and there's some, still leaking out, is that going to be bad for him if he's going down on me? And she said, no, it should be all right. Just make sure you don't use it just before having sex, and, use it afterwards. So I have actually had sex since starting on the Avestin cream, and I had used it the night before, but I was still worried, it was like almost 24 hours later, but I was still worried that there would be some residual cream there, and I wasn't worried that he'd, grow boobs or anything, anything bad like that would happen. But I was worried that it would change how I tasted, or that he might notice it. But he gave it a really good go and didn't say anything. Actually said it tasted great. So he obviously couldn't taste the cream. That, or he liked the taste of the cream. I don't know. I'll never know. But that set my mind at ease that I can use it the night before and then have some oral sex, and it's fine. No one's going to know. What was the other sex thing I wanted to talk about? Before I had the hysterectomy, I'd been seeing this guy, like a friends with benefits type thing, I guess. But I didn't see him again after the hysterectomy, and I had been really curious because they removed my cervix. They remove the cervix, which is at the top of your vagina, and then they stitch it closed at the top and makes like a vault. And I'd read things about ladies saying that it made their vagina shorter. I'd read things about ladies saying it made their vagina longer. And I was worried that it would make me feel different when a guy was actually having sex with me. But because I hadn't slept with that guy again afterwards, anyone that I slept with after that wouldn't have known what I felt like beforehand. So there was no comparison there. I know for myself when I've put my fingers in there to feel around, I can't feel the top of my vagina anymore, whereas I used to be able to feel my cervix right at the very top. So to me, it does feel longer. But as I said, I had no one to be able to compare it and say, oh, you know, I slept with you before the hysterectomy and I slept with you after the hysterectomy, and this was, you know, how it felt, you know, better or worse or the same or whatever. But I had the opportunity to have an encore with this guy from immediately before the hysterectomy a few months ago. And so I asked him, I said, you know, does it feel any different to the last time? And I can't remember exactly what he said, but it was along the lines of it just felt really tight. It felt the same as it always did before. So I thought, I can't complain about that. There's no difference there. He would be the only person who would know. And I know the sort of bloke he is, he would have been completely honest. If there was any difference for him, he would have let me know. So that was a really big relief for me. Oh, sweetie. So what else do I want to talk about? I've got all the yucky sex stuff out of the way. Now, I have noticed since I've been using the Avestin cream, especially when I was using it every night for 3 weeks, my boobs have been so sore. Like, and they just feel so massive. I mean, they're big enough as it is, and I do, like, you know, you have those hormonal swings where, you know, some days you just get up and your boobs just feel gigantic. But my boobs have been feeling like they're just going to burst open. And one of my boobs in particular, it's not too bad now, but when I was using the cream every day, just in here, underneath at the side, it was so sore. It's like it felt raw inside, like it was almost like it was tearing. It was awful. It felt actually very similar, because I've had the massive breast reduction as well. I had some really bad pain after my breast reduction and after the revision surgery, and it felt like that. So it actually felt like a surgical wound, the sort of pain. It was fine during the day, but when I went to bed at night, I sleep like a rotisserie, I roll all night, but I fall asleep on my right side. So I sit up in bed before I go to sleep and I play a colouring in game on my phone, and then I get really tired, put the phone away, and then I roll over onto my right side. And as I was rolling over onto my right side, because I only wear a singlet, I don't wear a bra to bed, and as I was rolling over and my boob was, you know, like sort of like falling across my body, it was like pulling and really hurting, and it was hurting so much that I was having to like hold my boob up as I was laying on that side, and I was, you know, like rubbing it to try to make it feel better, and I was having trouble sleeping. So I spoke to my GP about it. She had a good feel around, and I mean, I get her to check my boobs every 6 months anyway. Because my boobs are so lumpy, I can't do it myself. They're just too lumpy for me. And she has a heart attack every time she feels them, and I've had so many ultrasounds and mammograms and everything, and everything is actually fine. I'm just one of those people who's got really, really lumpy boobs. So she had a feel, and she said it just feels like normal breast tissue to her, but she said to make sure, because I'm due for my 2-yearly mammogram in July, she said to make sure that I did actually go and have that mammogram this year and to not miss it. And I said, well, you know, I wouldn't anyway. So I've called up about that, and you know, they asked if I've got any symptoms or whatever, and I said, well, you know, I've got some pain. I've had my GP check it, but, you know, I do have the pain. So they've brought it forward. They're going to do the mammogram for me in May, so that's not too far away. They're very, very banked up because of COVID. But, yeah, since I've backed off the Avestin cream to only twice a week, the pain has really, really, really reduced to almost nothing. So I'm not worried. It's obviously hormonal, and maybe the estrogen cream has, I don't, like, well, obviously would have changed my hormones, and even though I'm only putting it on topically, some of it will be getting into my system, and because my body is very, very sensitive to most medications, that has maybe just affected my boobs a little bit, so I'm not too worried about that. The other really big thing that I've noticed, and I have spoken about this in a couple of other videos because it was a really massive deal for me. If you've seen my other videos, you know that I've lost a shit ton of weight, and when I did lose a lot of that weight, and it may have just been coincidence with starting to go through menopause, you lose weight everywhere, and you get loose skin, and your body's not as full as it used to be. And apparently that happens with menopause as well. So I started having a problem with anything I was wearing, like jeans, leggings, sometimes just undies, or just my thighs pressing up against my vagina, or like the external bits around the labia. And it was pressing very, very uncomfortably against my clitoris, to the point where if anything was like crushed up against that part of my body, it was making me feel aroused, inappropriately aroused. Like I could be sitting in a doctor's waiting rooms or on a train, or, you know, out to lunch or whatever, and if my jeans like went across that area and like sort of pushed up against, like any part of any clothing can do, where it creases where you sit down or where you move or whatever, if it like pushed in against that area, it was very extremely uncomfortable. And because my clitoris didn't know the difference between a good time and just something rubbing there that shouldn't have been, I was getting aroused. And so I'd spoken to my GP about it, I spoke to gynecologists about it, I spoke to plastic surgeons about it, because I was thinking I've got to have labiaplasty now to fix this, because this is just, I can't deal with this. This is just too uncomfortable. I thought maybe I need a Mons lift, I don't know. So I'd spoken to all of them about it. They all thought I was really weird, and you know, plastic surgeons didn't want to touch me, and gynecologists thought I was crazy. And although the gynecologist did examine me, and he said that I had some atrophy in my labia related to massive weight loss and getting older, like menopausal changes, which just means that the skin of my labia wasn't as thick anymore, and the lips weren't as full as what they used to be. So I thought, well, that's just another casualty of, you know, losing so much weight and getting older. And I thought, well, you know, no one's going to help me with this. So, you know, I had just actually resigned myself to, you know, that's just how it is for me now. And then I'd been on been using the Avestin cream for a little while, and I got in the car to go somewhere, and I was wearing jeans, and because I know people would say, well, just don't wear jeans, but it would happen. It would happen sometimes, even just in undies. It was, you know, it could happen whatever I was wearing. So I got in the car, and normally I'd get in the car and I'd sit down and I'd have to like rearrange everything all around, you know, all around my crotch, and, you know, try to get the seam so that it wasn't pressing on anything, and it was just a nightmare. I could do that in the privacy of my house or my car or whatever, but when you can't do that when you're in public. So I got in the car and I was waiting for that to happen, and I thought, oh well, I can feel it pressing there, because, you know, like I'm sitting down in a pair of jeans, but that's not uncomfortable. That doesn't feel weird. That just feels normal. And so I spoke to my GP about it, and I said, could that be the Ovestin cream? And she said, yeah, because, you know, it like reverses the effects of menopause. So it will have filled out my skin and made things just fill out a bit more like they used to be. I thought, whoa. So I came home and I got the mirror out and I had a look, and it does. It looks different. It looks more filled out, like I'd forgotten how it used to look back in the olden days. So it's given me a more youthful appearance, which is nice. But I'm just happy with. It looked fine before. I've never had a problem with how I look, and to me, I couldn't see that there was any sort of atrophy. It didn't look any different to me. But now that it's all filled out again, in retrospect, I can see that it looked a little bit different, but it still looked fine. Now it looks how it did years ago. So that's it. I just thought I would update people in case there's other people who are going through this, whether they've had a hysterectomy or they're going through menopause and they're having these same sorts of issues. Maybe this would help you, but, you know, yeah, I mean, you've got to get a script for it anyway, but maybe talk to your GP about it and see what's going on. And that's it. That's it for now. I'll talk to you. Actually, I'll update you after I have my mammogram, so everyone knows that everything's fine. I'm like not expecting anything weird.